I'm glad to see some names that I recognize in the participants list. If you want to, just everyone in the participants list, if you want to just quickly just say what's your name I can see. If you want to just say where you're located, generally if you're in New Jersey, and especially what role you have on the educational team, or if you're a family member of a student with CVI, just to get a sense of sort of who's in the room. If we have speech pathologists, if we have OTs, PTs, I see a nice range of people already. So as you do that, I'm going to just share my screen and get set up. Okay, I'm going to open up the chat box. And as Angel said, I am happy to field questions as they come. I've tried the route of saving questions for the end. And when I do that, we just run out of time and nobody gets to ask their questions. So instead, I think it's useful to be able to just kind of talk as we go. If there's anything that I am explaining or introducing you to that requires some clarification, or if you have specific examples that are sort of aha moments about your children or students, please feel free to just share them in the chat box as we go. I'm also going to upload some materials into the chat box as I talk about them, so that you can download them directly if I introduce you to a resource. And websites, if I show you a resource that's a web-based one, I'll put that in the chat box as we go too. You will have at the very end of the presentation, I'm going to put the actual slide presentation as a PDF into the chat box. So if you feel like you're getting a ton of information and it's a bit too much to manage, don't feel like you have to take extensive notes or screenshots or anything. I'm going to give you the whole presentation at the end of today too. So without further ado, let's just get into it. So today we're going to be talking, I'm going to give you an overview of characteristics and phases of CVI, as well as sort of a very brief introduction to the assessment process as it relates to understanding the functional vision of students with CVI. I think, maybe with another hour or two to spare, we could get deep into assessment. But for now, I just want to kind of give you enough of an overview so that you feel like you have a starting point, you have questions to ask, and you have things to specifically target observing in the students that you work with or with your own children. We're doing a part 2. I think Angel can give you the specific date. I don't remember, I think off the top of my head. Is it in December? Like a month from now, we're doing a part 2. And the part 2 is going to focus on intervention practices, supporting educational programs for students with CVI, as well as a more intensive focus on adapting communication systems for students with CVI and complex communication needs. You see there also, I know that the New Jersey Deafblind Project is offering, you're offering CEUs, right? Great. So you'll want to make sure that you get the information for that. Sure, go ahead.
Sorry. Wait. Okay, if you want to see you, put your first name, last name, and your email address in the chat box, please. Sorry.
Sure, no, that's great. Thank you, Michelle. Okay, so let's just get going. Just a sort of little bit of an opening, and for context, the information that I'm sharing today and the ideas and approaches that I'm sharing are definitely based specifically on the approach to assessment and intervention that was developed by Dr. Roman Lancy. She has a newer version of her textbook that I'm sure many of you are familiar of, first came out in 2007. And this is a specific approach to understanding the unique visual characteristic behaviors of students with CVI and adapting educational programs that are based on how that student is currently performing in terms of their functional vision. So we have sort of other ways to look at CVI. We have certainly other research about CVI, but this is really the only approach that's firmly based in educational assessment and educational intervention. So other work you might find out there may be more from the field of neurology or from neuro-ophthalmology, and may give you some useful information about diagnostic criteria, understanding what's happening in the brain, and so on. But this is really the approach that we have to functional assessment and intervention for educational settings and for learning. Just a little credit where credit is due. All of the photographs, all of the ideas that are specific examples of adaptations for students that I'll show you, do come from my direct collaboration with professionals, and you can see a pretty wide range of professionals there in terms of roles: speech pathologist, teacher of deaf, hard of hearing, folks at our national center, NCDB, TVIs, and families as well. Okay, so let's start with just getting a strong shared definition of what cortical visual impairment is. Cortical visual impairment is vision loss due to a connection that's happening in the processing centers of the brain. So typically in children with CVI, the ocular structure, the eyes are working fine. It's the processing of information coming in through the eyes as it goes further back into the visual processing centers of the visual cortex in particular, and of the optic radiations and some of the other parts of the brain that interpret visual information. So when someone asks, what does a child with cortical visual impairment see? A fair answer would be the same sees, because the information that comes in through the processing centers of the brain. So it's more, what does a child with cortical visual impairment process or understand about what they're seeing, that we should be asking. CVI is known to be, and has been accepted for the last maybe at least 10 years or so, to be the leading cause of childhood visual impairment, or visual impairment in young children living in, and I think we used to say, and I used to say, developed countries, or just even the US or the Western Hemisphere. But I think it's more fair to say that CVI is the leading cause of childhood visual impairment in countries or in regions of this country that have access to quality neonatal health care. And why is it important to stress neonatal health care? Because the overwhelming majority of kids with congenital cortical visual impairment, or cortical visual impairment from early childhood or at birth, is caused by complications related to extremely low weight or very premature gestational birth. So we're talking about kids who, 20 or 30 years ago probably would not have been as likely to survive low weight premature birth, 21 to 28 weeks gestation. And now these children are surviving at a much higher rate if they have quality neonatal health care. And it's not that all children who are low weight preterm birth have CVI, but rather that they are at risk for a variety of different traumatic brain injuries that can cause CVI. And we'll look at what those are. It's critical to understand that CVI is totally different from other non-brain related visual impairments. So if you're a TVI, a teacher of the blind or visually impaired, if you are if you're a person who's worked with students who have ocular or eye related visual impairments, even mild, acuity issues requiring glasses, the impact of CVI is completely different from any of those things. And we have to reframe our thinking about what CVI does and how it impacts a child to understand how we might adapt materials to meet that child's needs. So in understanding ocular visual impairments or eye-related visual impairments, we can basically look at the cross-section of the eye, what we see on the top left here. The front of the eye is on the right, the back of the eye and the optic nerve that leads to the brain is on the left. And if we know what specific condition a child with an ocular visual impairment has, we know where the impact is inside of the eye, and we know how severe the impact is, and whether it is a stable or progressive condition, we can pretty much guess what it's going to do in terms of its implications on vision. So for example, if you have a cataract, that would be an opacity or an area that's not clear in the lens, which should be clear in order for light to pass through. We know that a cataract causes reduced visual acuity. We know that a cataract causes decreased contrast sensitivity and increased photophobia, or sensitivity to light. That's going to be completely different than the impact of a retinal issue, an issue in the retina in the back of the eye, which may cause spots in vision or holes in vision if it's a retinal detachment, or if it's a progressive retinal condition like retinitis pigmentosa, it's going to cause tunnel vision, it's going to cause night blindness, and so on. So for ocular conditions, if we know the condition, we have good medical reports, good clinical vision reports, and we know what the status of vision is, we can pretty much guess how that's going to impact functional vision, and then we can assess accordingly. We really can't do that with CVI because we can't look inside the brain to be able to tell how is the brain processing visual information. And I've had these conversations with neurologists, including neurologists who have access to live MRI and even live micro MRI. And my question was, could we put like a live micro MRI, on a child and show them things with CVI and show them things that we know a child with CVI is going to have an easier time looking at? And could we see where the activity in the brain is? And the answer is no. We really don't know enough about visual processing centers of the brain to be able to pinpoint what's happening from an MRI or a CAT scan perspective. So the information that we get about CVI is observational and functional information rather than clinical. Of course, children with CVI can have additional ocular visual impairments. The ones that I see most often are strabismus or amblyopia. On the bottom left here, you have a picture of a child with strabismus or amblyopia, an ocular motor impairment where the eye is drifting out, if it's exotropia or it's drifting in or up or down. And we kind of know what this does to visual functioning. We know that it can cause some depth perception issues, usually mild. We also know that it can basically result in a child preferring to use one eye over another. So if one eye is a little weaker, then in terms of acuity or in terms of ocular motor strength, the child's going to prefer the eye that's stronger. So again, we can kind of guess what the impact is. If you have a child who has both CVI and another issue, another ocular issue, you really have to treat the two almost separately and pick apart what the specific impacts are. In general, when I've seen kids who have both ocular and CVI, the CVI is noticeably more impactful. And so it's really important to focus on the impact of the CVI. Okay. So like I said, CVI is not, we can't get a ton of information from clinical or medical reports about CVI beyond just diagnosis. And diagnosis itself is a pretty loose, has a pretty loose criteria. So the major criteria for diagnosing CVI are these three pieces. There must be some history of brain injury or malformation that could explain the neurological visual impairment that's occurred. And we'll look at some examples of what those common medical histories are. There must be a clinical eye exam from an ophthalmologist or an optometrist. And the reason for that is that we want to be able to rule out if there's something else going on that could be explaining the abnormal use of vision. So we want to know, is the structure of the eye healthy and, and okay? Or is there something else going on that we also need to be aware of? Most importantly, and this is why CVI is such an observational area, is that such an observation-based condition, is that there's the presence of unique visual characteristics. And these are the CVI characteristic visual behaviors that we're really going to spend most of the time today talking about and understanding. Here's just a short list of medical history that's significant for CVI. And the top two that you see here are the most common causes of CVI. Both of these are causes of CVI that are common in students who have who have a history of early preterm or low weight birth. So the first one, HIE, hypoxic ischemic encephalopathy, and the second one, PVL, paraventricular leukomalacia. Those are conditions related to lack of oxygen or too much oxygen going to the brain usually at or around birth. Those are common conditions that happen in preterm infants. Paraventricular leukomalacia in particular causes deterioration of white matter in the brain and can result in sort of damage to the areas that affect visual processing. Seizure disorders, CVA or stroke, intraventricular hemorrhage. We don't need to go through all of these, but these are all sort of red flag conditions that could be causing CVI. It's important to emphasize at the bottom there, I have prematurity italicized and it says not a cause. Prematurity is not what causes CVI. It's those events that can happen around premature birth that cause CVI. So namely HIE and PVL. Also, cerebral palsy is not a cause. Cerebral palsy is an associated condition because whatever caused the cerebral palsy could also have caused CVI at the same time, such as a seizure disorder, infantile or febrile seizures, stroke pre-birth, or prenatally, perinatally, or postnatally, or traumatic brain injury around early childhood. So traumatic brain injury can occur at any age, of course, and traumatic brain injury at any age can cause CVI. We should still expect progress for older students who have acquired CVI, and we'll speak about that a little bit more. Again, if there are any questions that come up throughout the conversation today, please feel free to type them into the chat box. Okay. The most frequently asked question that I get, and I'm sure some of you have seen this exact same question come up in your work, are that the clinical eye reports are normal or unable to test, but I know that the child's visual functioning is not typical. Okay. This usually happens with students with multiple disabilities, and it's because the ophthalmologist or the optometrist doesn't know how to test that student. They don't respond to typical eye exams. They are not reading letters, and so they can't, look at a typical acuity chart like the kind that you see at the DMV, a Snellen chart. If you ever see the term unable to test on a clinical report, you should interpret that as meaning, I don't know how to test this student, and instead you should go find somebody who does. There's no such thing as unable to test. There's always a way to effectively and functionally evaluate a child. It just might not be a standardized clinical way. So the questions that you should be asking yourself, and if you're someone who works with families, you should be helping families to understand how to respond to this common situation, is does this clinical vision specialist, whatever their role is, ophthalmologist, optometrist, neuro-ophthalmologist, pediatrician, or neurologist, does this clinical specialist recognize or diagnose CVI? If not, go to someone who does. And I would recommend, in your own area, especially for you folks who are, I think most of you are in New Jersey, talk to each other and get recommendations about who is a great clinical vision specialist, or who are multiple clinical vision specialists that are able to diagnose CVI and have good information about it. And also that have skills in working with students who are prelinguistic, students with multiple disabilities, and who aren't going to give that answer unable to test. The reason that clinical eye reports come out normal is because the eyes are usually healthy. And so you get a clinical vision assessment that says the eyes are perfectly healthy. Whatever you're observing must just be because this child has multiple disabilities, so they're not attending. Or even worse, I've seen, it's probably because the child has autism or learning disabilities. And it's sort of chalked up to that, as opposed to information's coming in through the eyes fine, but it's getting caught up in the processing centers of the brain, and the child's having difficulty interpreting what's coming in their eyes. It could be a neuro-ophthalmologist that you're looking for. That's an ophthalmologist who has specific background and expertise in neurology, but not necessarily, because neuro-ophthalmologists usually are specialists who diagnose other neurological vision issues, visual processing issues, such as dyslexia or synesthesia or prosopagnosia, face blindness, other sort of conditions that would be called cerebral visual impairment, but aren't the same necessarily as cortical visual impairment. Okay. And as I said, diagnosis is important for mandating services and for, getting next steps in place, of course, but it doesn't really give us that much information about functionally what's going on. What's really important is that we follow up any clinical assessment and diagnosis with a functional vision assessment that's appropriate to understanding what's actually going on with the child's vision. So what if the functional vision assessment itself doesn't address CVI? Then you want to ask the same kind of question. Does the vision specialist, the educational vision specialist, have training in CVI, and specifically in using assessment that is appropriate to addressing the unique characteristics of CVI? which is the CVI range. The CVI range is a specific assessment protocol, which we'll cover a little bit more in a bit, which is geared specifically towards understanding the characteristic visual behaviors of CVI. Now, you can't necessarily mandate a specific assessment tool like this. You can't say this child must be assessed using the CVI range, but what you can say is that the student must be assessed in a way that's appropriate to understanding the unique impact of that child's condition, which is different from an ocular condition. Anybody who has training can administer the CVI range, this assessment that we'll talk about. It doesn't have to be a TVI. However, only a vision service provider, a TVI or an orientation mobility specialist, or a certified vocational rehabilitation specialist can provide an FVA, a functional vision assessment. So I encourage OTs, I encourage speech pathologists, anyone on the team who's interested to get this training and to understand how to do this type of assessment specifically, because you can integrate that into your own toolkit for an OT evaluation, for a speech evaluation, but you can't call it a functional vision assessment. That's an evaluation that's provided specifically by a vision service provider. Okay, so why is it so important to identify and assess CVI? I mean, I think hopefully I'm preaching to the choir here that you would all think that it's important to understand the specific child has and the of those conditions. But what's rooted in visual functioning with the right intervention, with the right support, we actually expect that the child is going to improve their vision over time if we do the right thing. That's not true of students with ocular visual impairments. If you think about it, a student who is blind from an ocular visual impairment or has low vision, we're not expecting that their vision is going to get better. Instead, we're teaching them compensatory skills to get around the fact that they have a visual impairment. But in CVI, we're actually working to improve neurological functioning and to strengthen the child's ability to understand what they're seeing. So this is quite an exciting area of CVI. And personally, this is something that I like to say in a positive light to families and to professionals. We're going to see progress here. There's no reason that we shouldn't see progress if we do the right thing. The only cases in which you might not see progress is if a child has a degenerative neurological condition, like a severe seizure disorder or a specific chromosomal or other syndrome that is degenerating over time. And then you may not see that kind of neurological progress, obviously. But in any other case, we should expect progress. It has to be based on assessment. And the reason it has to be based on assessment is that there are unique and different, very distinct approaches to intervention that we're taking, depending on where the child falls on this range of visual functioning, from least severe to most severe. Intervention has to be a team effort. Of course, this is probably true of any intervention, but with CVI, what's unique is that because we're trying to make actual neurological improvement in visual processing, we can't see that kind of progress if we're just thinking about, a 2 times 30 minutes a week with a TVI in a pull-out session. That's not enough time in the week to make, concrete neurological progress. It needs to be integrated throughout the day. It needs to be integrated throughout the educational program, and it needs to be crossing over between school and home, sort of shared efforts and shared practices. So that's why it's so important for everyone who works with a child with CVI to have at least an elementary understanding of what's going on here, what the characteristics are, what's happening in the child's vision. And everything that I just said and some of the stuff that I'm going to say is all on this 2-page fact sheet that I put together. And to be honest, I made this fact sheet because I realized that I was typing out the same answers to the same questions over and over again over email, or explaining things over and over again, because I did see the same questions coming up consistently from families and from professionals. So I put them all together onto a 2-page fact sheet that sort of runs through the definition, What is CVI? How is it different from other visual impairments? How is it diagnosed? Sort of who can diagnose it? What are the characteristics, which is what we're going to go through next? What are the phases? And then the back is sort of an FAQ, who can diagnose it? What do I do if the eye exam says normal? What do I do if the FVA says, isn't appropriate? And then some sort of clarification of terms that can be confusing, like cerebral visual impairment or cortical blindness. There's also the second half of that page is links to additional resources. Now, before I go any further, let me just press escape real quickly, because what I wanted to do is to, as we go, share some of these resources for you. So in the chat box right now, let me see if it actually loads. Oh, I guess it's not loading. I was going to input the files into the chat box as we go, but instead what I can do is I can send them to Angel and Michelle and they can share them with you. So anything that I introduce you to here, I'll just make sure that you have access to it after the fact, okay? All right. So with ocular visual impairments, eye-related visual impairments, it's useful to be able to do some sort of a simulation to understand what the child's visual impairment looks like and what it might look like to have glaucoma, what it might look like to have retinal detachment, and so on. For those types of simulations, we can usually, even just look up a YouTube video, glaucoma simulation, and you'll probably find a good one. They also make goggles or, adapted sort of glasses that you can put on to simulate a visual impairment. We really can't do that with CVI because it's the processing centers of the brain that are having difficulty, not the eyes. So in order to say, what does it look like to have CVI, to really understand what that might be like, it's most effective, I find, to get a good understanding of what's actually happening in the brain, what's going on from a neuroprocessing level. And that gives us a good idea of what it might actually look like. So I'll give you the basics. First of all, because we don't have the time to get into something more intense than that. But second, because I think the basics is about as far as I can go on the neurology side. So it's complex information, but I want to make sure that you have at least a frame of reference for what's happening inside the brain. Okay, so in the brain, in the visual processing centers of the brain, which are actually in the back of the brain, mostly in the visual cortex. And if you know child development and brain development, you know that brain development is from a back to front sequence. And so what's in the back of your brain is developed earlier on in your life, and it goes from back to front, which explains why teenagers are not able to make good decisions or to be rational or logical or problem solve, because all of those areas of your brain in your limbic system and in your frontal lobe are right at the front, and they're really not developed until you're in your 20s or mid to late 20s even. So what's in the back of your brain should be relatively well developed at birth, and the process goes forward. So in the back of your brain, in your visual processing centers, in the visual cortex, you have two primary streams of information. And you can think of these streams almost like roads or highways through which vision is processed. Comes in through your eyes, and it immediately, instantaneously goes to this processing center in your brain. And in typical visual processing, we are constantly using these two streams together at the same time. They're integrated and they're both processing the same information at the same time to be able to give you complex results for what you're seeing, and classifying what you're seeing and categorizing it. So the first stream is the dorsal stream. The dorsal stream is called the where stream because it gives you rough information about sort of where things are. It gives you a lot of input about movement, that something is moving around you. It gives you information about what forms or shapes are around you. It gives you information about lighting, whether it's low lighting. I can tell right now over in my periphery, there's a window here, so it's kind of bright, whereas over here in the darker side of the room, it's not as bright. It gives you no information detail. It tells you what you're looking at, you sort of roughly where it is, and then give you information about what you're looking at. And you know that you're using your ventral stream when you're making what's called eye to object contact. Eye to object contact is direct visual fixation, looking right at something. So I've got this little toy truck, this little yellow toy truck. If I'm looking right at it, making direct eye to object contact and prolonged visual fixation with my central vision, I can tell lots of information about detail, right? I can tell where the wheels are. I can tell the different components and parts of the truck. I can explore it visually. And I can even see that there's writing on the side of it. And I can read that writing and I can tell all the detail from it. If I'm not using direct visual fixation or eye to object contact, and I'm looking sort of past or to the side of something. So right now I'm looking straight ahead and the truck is in my right visual field around 2-3 inches from my face. I'm only using my dorsal stream when I only use peripheral vision. So my peripheral vision gives me information about movement. I can tell if it's moving or not. I can even tell if the wheels are moving. I can see the general form and shape of it. I can see the bright color. I can see that it's a bright yellow color. If it's illuminated, if I'm shining a light on it, I can tell that it's illuminated even without looking directly at it. But I get no information about detail or acuity. I can't read the label. I can't find the different parts of it. I can't really explore or orient toward it. So if you know kids with CVI, you've probably guessed what's happening. Kids in CVI on a early to late progression. So if you start with the most severe CVI, phase 1 CVI, we're talking about kids who really only have a little bit of dorsal stream processing. They don't have any ventral stream at all, and their dorsal stream is just starting to develop. And so they may be able to see things like this, a bright red glowing light in their peripheral field, maybe in a specific peripheral field, right or left. They can see the color, they can see the bright light, and they can see it if it's moving, but they can't tell what it is. As a child with CVI makes progress in their visual processing, they're strengthening their dorsal stream, and then they're starting to integrate their ventral stream. And you know that a child is starting to integrate their ventral stream when they're beginning to make eye to object contact, right? When they're beginning to be able to look directly at something and establish direct visual fixation. That's at around 5 on the CVI range. So that's around the middle, which we'll talk about at length into phase 3, closer to typical visual processing. It's all about strengthening the ventral stream and understanding what it is that we're looking at, classifying it, and higher order visual processing skills that we're going to look at as we go. Okay, so if that seems complex, here's a little visual for you, kind of just breaking down sort of the fact that in typical visual functioning, these two streams are constantly working at the same time. They're giving information from the back of your brain and circulating it to the various parts of your brain that they need to go in order to understand visual information. And you can see the dorsal and the ventral are sort of separate here. And we see that each one deals with different areas of making sense of vision, making sense of visual information. Okay, now because I find this helpful, I'll do this as well before we get into characteristics. Again, it's not really possible to do a strong simulation of CVI, but the best one that I could do is this. So you've got a cup, right? Like a mug or a cup with a bunch of stuff in it, right? Pens, these are all the one that I'm holding up in front of me. If you have if you have my camera view up, is got a bunch of different pens in a mug, and they're all kind of gray or black or white. There's not really any bright colors here. And so if I'm holding this up to the side of my vision, right, I'm not looking right at it. I'm looking about 3 inches to the left of it. Can I find a specific individual pen that I want without looking at it directly, just using my peripheral vision or my kind of dorsal stream? And can I find, let's say, can I find this pen? Let's see. I really can't, because they all kind of blend together. It's very complex. There's nothing that stands out. And I find myself kind of feeling around. And this is what you'll see your kids with CVI doing. If they're not making direct eye to object contact, they're kind of feeling around. They're, they're their reach is not very accurate, their coordination is not very accurate, and they're kind of overwhelmed by this complexity, and they have difficulty understanding what's all this busy stuff over here. However, if I add a brightly colored pen to it, this is a bright yellow highlighter, I know that in my dorsal stream and my peripheral vision, I get a ton of information about bright saturated colors. So I'm going to stick that pen in there. And now can I find that pen, right? Right to it, found it, no problem. That's because in your dorsal stream, you get good information about bright saturated colors. Also, if there was some movement, I would be able to see the movement. If it was illuminated, I would be able to see that light. But there's another thing that happens here, which is complexity. So if I take away all of those other pens, now I'm taking away all the busy, complex visual information. Now can I find it? Yes, no problem, right? Because I'm not caught up by that complexity. So what I like to ask teams who are working with kids with CVI to do is to simulate something like that that's relevant to the curriculum and to the instructional materials that you present throughout the day. How much busy information are you expecting your student to be navigating? You can do the same sort of simulation with your phone. I think this is a good one for understanding access to communication systems or to students who use alternative communication modes like devices or an iPad. And try the same thing. See how much can you actually do on your phone from motor memory, and how much do you rely on visual information? Can you look to the side of your phone, 3-4 inches to the left of it, and enter in a passcode? Can you find a specific app? Do you notice that apps that have brighter colors are easier to find, whereas apps that have duller colors on their icon are harder to find and blend into that busy or complex background? Okay, so again, these are rough simulations. They're not telling us what does a child with CVI see, but they give a good idea about how visual processing affects functioning as it relates to dorsal and ventral streams. All right, CVI has been described as like looking through a kaleidoscope. And this is a quote that I heard Dr. Roman shared from, I believe it was from a teenager who had CVI from a traumatic brain injury. And so this is somebody who could remember what it was like to have typical visual processing and was describing what it looked like now to have CVI. So if you imagine looking through the world, looking at the world through a kaleidoscope, imagine how much visual complexity would affect what you can see and what you can understand about what you're seeing. So if you're looking through a kaleidoscope at a busy preschool classroom with lots of materials all over the place, a shelf full of sensory toys, artwork all over the walls, it would be really hard to tell what you're looking at because all of that complex information would sort of blend together and it would look like a weird kind of fractal, right? But if you're looking at a blank wall, white or black blank wall with nothing else around it, and a bright red pom-pom, right? Or a bright red ball, you probably would be able to see it pretty well. You'd be able to tell what color it is, what shape it is. You might even be able to identify what the object is. So that's an issue of complexity. And as we talk about CVI characteristics, we're really going to understand how critical visual and multisensory complexity is to understanding and interpreting information. Okay. All right. If there are any questions, again, please feel free to just type them into the chat box and we can answer them as we go. What we're going to do now, and probably for the majority of our time together today, we're going to really dig into the unique visual behavioral characteristics of CVI. And as we go through each of these 10 characteristics, we're going to look at how each one impacts visual functioning. The child's ability to use their vision to access information throughout the day. So we're going to talk about how each characteristic impacts that, with an understanding that characteristics affect children differently as their visual functioning improves along this range of visual processing. Those are phase 1 being the most severe, phase 2 being sort of middle moderate, and phase 3 being closest to typical visual functioning. It's the same characteristics, but they look a little bit different as the child makes progress along the CVI range. Now, the range is a continuum between 0 and 10. And the reason I say it's a continuum is because there's no such thing as 0. There's no child with CVI who has 0, no functional vision. That would be ocular blindness that causes no functional vision. Every child with CVI has some vision. It may just be very, very, very slight. And I have seen examples where the only thing that the child was able to see was a bright glow stick in a dark, quiet room in a specifically in their right visual field or left visual field at 2 inches away with a lot of movement and several minutes of processing time. Now that's very low visual functioning, but it's at least a starting point, and it's a place that we're going to start for intervention for that child. And we're going to expect that that child can make progress. So we need to know where the child is now on this continuum. There's also no such thing as 10, because 10 would be you don't have CVI and you can't get rid of or resolve CVI. You can get pretty close up there, but you can't completely get rid of it. Of course, the difference between a 1 and a 9 is an absolutely massive difference. That's the difference between a child who's only able to look at bright, colorful, light up things in a quiet environment with visual processing time to a child in, phase 3, 8 or 9, who's able to read, read large print on an iPad with a little bit of color highlighting maybe, and a slant board, just for example. Okay. So let's dig into the characteristics. And again, as we talk through each one, we're going to think about how it impacts a child sort of on the lower end of visual processing, phase 1, and then how it impacts another child a little bit higher up on the CVI range in phase 2 or on into phase 3. The first characteristic is color preference. Okay. Children with CVI, because they have dorsal stream vision, they get that information from the dorsal stream, tend to have strong color vision. Okay, that doesn't mean processing, understanding different colors. It means that the child with CVI is able to see more easily colors that are bright and saturated. Often those are red or yellow. We usually think of red as being a go-to color for a child with CVI, and the reason for that is that red is pretty much an easy color to process and see across the board. Red is a bright saturated color. And in fact, you don't even need to have a visual cortex in order to process the color red. Your eyes and the very beginning parts of your visual processing in your optic nerve and in your optic radiations, before it even goes to the back of your brain, your eyes can process red. That's probably the result of millenniums of evolution, because if you think about it, things in nature that are red are usually things that alert us to important information, like stay away from this or don't eat this, right? So a child with CVI a little earlier on the range may only be able to see a bright color like red. Maybe they're only looking at things that are bright saturated colors or single color objects. A child further along the range, as they make progress, can look at any color and look at objects of any color, but they benefit from color to highlight important information and to tell them what it is that they're looking at. Okay, to provide a visual anchor or landmark for complex information. I'll show you some examples. Okay, right? You don't even need a visual cortex to see red. And using your dorsal stream alone, you can get information on color, right? You don't need ventral stream to give you information on color. Okay, so for example, here earlier on in phase 1 or early phase 2, lower on the CVI range, a child's only able to look at things that are bright, shiny, saturated colors and single colored objects. Okay, child's only able to look at a ball if it's a single bright color. A multicolored object wouldn't be able to process. It would be much more complex and difficult. That's why things like Elmo, dolls like Elmo, bright bright single colored, very easy target for a child to process who's a little younger or earlier in their CVI range. Slinkies tend to be motivating and interesting to kids with CVI because they often come in bright colors, but also because they also have a movement quality, which we're going to talk about next. A little further along on the CVI range, this is a child who is able to look at different colors, but she benefits from color to anchor her attention to important information. On a communication board, they're using this bright red rectangle as an anchor for where to put the communication cue to show what we're going to do now. This was an interesting one of a team that had a student with CVI who would get a bit overstimulated in a busy classroom, and he would get disoriented and stressed because he couldn't figure out where he was. He would get turned around and couldn't figure out where he was in relation to the door of the classroom. So rather than, painting the door of the classroom red, which would be kind of an adaptation overkill, what they did was they took a little bit of red electrical tape and put it around the light switch to the left of the door, so that when the student was disoriented and sort of scanning the environment, he would find that bright red target and it would tell him, oh, that's where it is. And it would help him orient in space. So this is like a visual landmark. If you're an orientation mobility instructor or someone who focuses on orientation and safe travel skills, this is the type of landmark we want to be providing. If you think about it, it's pretty similar to what we have out in our society for, out in our communities for Adults with Disabilities Act regulations. The bright red light up exit sign, right? In a movie theater or in a, in a building. It's in order to give you very clear landmark information about where you need to go, in the event of an emergency, or in, if you think about when the environment is more chaotic and you need that information, it's bright red and it's lit up. Similar type of information we're giving kids with CVI. On a more sort of curriculum and functional level, we're using color to highlight important information for literacy and communication purposes. So on the bottom left here, you have an adapted book. That's that book, Brown Bear. So you have a little bit of tactile adaptation, some fur for a child who is a little bit, earlier in phase 1 and still needs some tactile input. But you also have a bright color adaptation, which, if you can see it, is a little strip of sort of reflective, shiny and glittery material that they've used as a collar for the dog in the picture. And it helps the child orient towards the picture, but also towards the specific focal points of the picture. You find the collar, and then you can look to the right and find the head and the eyes. You can look to the left and find the fur. So it's teaching some early pre-literacy skills. On the bottom middle there, you have a communication card that is used in a preschool classroom for a morning circle where the team is, where they're singing, morning circle songs. And this is the cue for the song Head, Shoulders, Knees, and Toes. And on this student's cue, they've taken the same one they're using for the class, but they've just outlined in red puff paint, right? Tactile paint, a little bit on the head, a little red on the shoulders, the knees, and the toes. And it helps the student focus on that card as they go through the song. Whereas without that, the child is not looking at anything or has difficulty visually processing materials that are connected to the activity. Okay. Beginning to start thinking about, and we'll talk at great length next session in December about communication systems, but thinking about communication systems that have symbols that are very visually distinct with the use of color. Bright yellow next to bright blue, those really pop out and they stand out very easily for a child with CVI, as opposed to two things that look too similar to each other or have a similar color. Okay, so we're using color in different ways as the child progresses. Okay. The next characteristic here is movement. And we already mentioned this a little bit when we showed you the slinkies and the pom-poms, but children with CVI often need movement to attract their visual attention or to sustain their visual attention. Just like what we talked about with the example of the dorsal stream, it's very easy to get information about movement in your dorsal stream. So kids on the lower side of visual functioning, phase 1, may only look at things that move. They only may look at things that are shiny or have a movement quality, like a reflective quality. This often helps kids with CVI with mobility. So I hear frequently people saying about kids with CVI, well, when they're in movement, right, when they're walking down the hallway or when they're going down the hallway in their wheelchair, they seem to be looking at everything, but when they're stable in the classroom, they're not. The reason for that is that when you're moving, it's almost as if the world is moving. And so it's easier to process the information that's around you. You also may see a behavior of a child with CVI of rocking or shaking their head back and forth. It can be back and forth, or front to back. It can be a full body movement or just a head movement. This is easily misinterpreted as a sensory stimulation or like a self-stim activity, or even like an autism sort of activity. Don't misunderstand that, because kids with CVI frequently do that in order to get more information about the world by making the world move. So something is in front of me, this toy truck's in front of me, it's not moving, and I want to be able to see it better, so I'm going to move my own head in order to provide that processing that I need. If you see that happening and you're not sure exactly how to interpret it, try picking up something and moving it back and forth in front of the child. And what you'll see is the child stops. They'll stop their movement behaviors because they don't need to be moving back and forth if the object itself is moving. Okay. So further along the range, a child doesn't need things that are up close or at near to be moving, but they may benefit from movement at a distance to get their attention or to sustain their attention, or they may benefit from movement given unfamiliar and complex materials. Right, so at the lower side of visual functioning, phase 1, early phase 2, we're only looking at things that have a movement or a shiny quality. And further on, movement is used in a more functional context to be able to get our attention at a distance or during complex activities. Okay. The next characteristic here is visual latency. Kids with CVI have a visual processing, will tend to have a visual processing delay. This is different from a motor or cognitive latency. This is specifically the time between which an object is presented and when the child looks at or orients toward it. Nothing to do with their interest toward it. A child could look at it and decide, I don't care about that, and look away. We're talking about just the time between when it's presented and when the child notices that it's there. I've got this question several times about kids with autism having visual latency. Kids with autism don't have visual latency. They have restricted interests, which result in not trying to reach out for or spend time looking at things that are not interesting to them. But a child with autism will notice that something's there. It may be the briefest of recognitions of, oh, that's there, but I don't care. That's different from what we see in CVI. It can be anything from a split second, a few seconds, all the way up towards several minutes, like I talked about with the child who has only seen a bright, colorful light. Or it can be that the child needs warm-up time to be able to start looking at things without latency. So as the child makes progress along the CVI range, what we're seeing is that latency decreases with warm-up time, or that you only see latency come up when the student is tired, stressed, or overstimulated. This is sort of a classic image showing latency. You can see the student is presented with a bright, colorful movement. It's got the movement in it, slinky against a black background, should be relatively easy to see. And we see no looking, no looking, no looking, and then this look. But the reason I like this picture especially is that it shows what a common CVI look might be. It's not necessarily going to be that direct eye to object contact lower down on the range. It's going to be this sort of sideways or peripheral look, and that can go in any angle. It can be a little down or a little up or a little to the side, but it's what we call regard, visual regard, rather than visual fixation. Okay, so it's not eye to object contact yet, it's visual regard, but it's very clear and it's very observable. Okay, so just going to keep moving forward, and again, feel free to ask questions if they come up. Visual field preferences is the next characteristic. Students with CVI tend to have field preferences, and I want to clarify, these are not field losses. A child with an ocular visual impairment, like a retinal detachment or blindness in one eye, could have a field loss where there's no information in that field. A child with CVI tends to have field preferences, and the typical progression from from phase 1 earlier on the CVI range all the way up towards phase 3. First, what we see is one strong peripheral field. So I'm only seeing things in my right side. It could be right or left. And then as the child progresses, it's right and left, and then it's upper, and then finally central when we start to see that eye to object contact and fixation. And then the lower visual field doesn't tend to resolve or begin to be able to be accessed easily until way later on in the CVI range. And a lot of students with CVI never fully resolve that lower visual field and always are going to have difficulty in their lower visual field. So here's like a simple image. You can see just a child with something bright, colorful, and a right visual field, easy to see. This is an interesting one of a team that the student was just starting to develop some central fixation and direct eye to object contact. So in a morning circle time, they were showing him a mirror to show, when they're going around saying who came to school today. And when it was his turn, he would look in the mirror to identify that he came to school. And they had a creative use of the trifold board, which you usually use like to put in front of a student, right, to present materials. But instead they put it behind him in order to block off the busy background that was behind him and let him just focus on his own face. They also have the sides, the trifold part to the sides, to be able to block off distracting information that might be in his peripheral visual field. So he could really focus on that difficult central field. I want to show you just a couple of brief little videos of a student that are also sort of helpful to show these, and you can see sort of how these characteristics are overlapping. So if you look at these short little videos, I'll show you a few more as we go. What we're looking for is just understanding, sort of beginning to see where the student's visual field preferences are, that it might be easier to see something in one field, a little harder in another one, as you see vision develop. All right, here we go. Okay, so you could see in the right visual field, she was able to see that, but there wasn't a direct eye to object contact, right? You see sort of a shift. She notices that it's there in her peripheral field because of the movement, because the person there is moving it into her field. She makes a very brief fixation with her right eye. You can see she has some ocular motor issues. And then as soon as she's touching it, she looks away, okay? And she's really only regarding it peripherally. We're going to see that as another characteristic when we look at visually guided reach in a minute. Here's another one of the same student, and we can see a significant lower visual field deficit going downstairs. So watch how she uses her vision in this context.
You want to? Come on down. You like to walk on the grass? I like the way you're looking down. Okay,
Okay.
that's good, Christina.
You know what I find amazing? What I find amazing about this video is we see a little bit of use of looking down. Okay, so as soon as we're doing this complex activity, we get to that last step, we're not looking at all because the lower visual field is very difficult to deal with. Okay. Okay, we're not looking, we're not looking, we're not looking. And then we get to the grass and we're looking at the grass. Why would we look at that quickly and easily? Because it's a bright saturated color. And there's a sharp difference between this gray tone here on the sidewalk and this bright grass. So the grass is sort of a natural color adaptation for the student. And it's really, really helpful to orient her in space to recognize, oh yeah, look, there is one more step there. And she's really looking at it. It's kind of an amazing example of how color and visual fields overlap. Brighter colors in your lower visual field are going to be easier to see and they're going to pop out. And this is where very often we see kids with CVI, if you don't have this bright color contrast for a change in surfaces, you see the child getting a little nervous when they get to a step because they don't really know what's on the other side of that step. And you may see the child tapping with their feet to kind of figure it out. All right. So let's keep going. Okay. So the next characteristic is visual complexity. And I think that we could spend like a whole hour just talking about visual complexity. I really do feel strongly that this is really the overarching characteristic of CVI that impacts all of the other characteristics. And I think all the other characteristics we could see through the lens of this one. So let's see. Everybody remember Where's Waldo, right? If anybody is like maybe like a Generation Z person, then you may not remember, you may not know Where's Waldo, but I think the rest of us are familiar. And if you remember Where's Waldo, you know how visually complex these materials are. Imagine for a student with CVI, the whole world looks like one of these sorts of incredibly complex and busy scenes. And it's very hard for the student with CVI to figure out where is that visual target that I'm supposed to be finding. And what you'll see in children with CVI, if they don't make eye to object contact and they don't have advanced visual searching skills, which is way, way, way later, then they don't really know where to start. And they have difficulty finding a point of reference. That even just watch what you're doing with your own eyes when you're looking for Waldo, and think through in your own experience, if you found him already, or if you haven't, what are you doing? You're looking around, and you may even be separating this scene into quadrants: top left, top right, bottom left, bottom right. So you can tell yourself, oh no, I've already looked there and he's not in the top right, so I'm going to look in the bottom right now. I know he's not there, so now I'm going to look in another quadrant. Those are advanced visual scanning and searching skills that students with CVI just don't have. Okay, and need to be able to develop in clear and informed ways through guided practice. So what is that going to look like? Well, let's think about the other characteristics. Does it help to adapt this with color? Okay. That's pretty helpful to all of us who do not have visual processing challenges and don't have an issue with the rest of this complexity. Just outlining Waldo with a bright red color. Now we know exactly where he is, and if I take that away, you can find him again because I've given you a little preview. Okay, there he is. Okay, now find him. Now that might be enough for a child way far along in, well into phase 3 of CVI. Probably not for Waldo, but maybe for looking at a picture book or looking at photos or so on. For another child who's a little lower down on the CVI range, you may need to also block out the rest of the visual complexity. So how about just blocking out everything else with a window or an occluder to be able to show that's where he is? So we need to find a combination of what's going to work here. Do we need to reduce the complexity of the array of the situation in front of the student? Or do we need to highlight information? Or do we need to do both? Waldo is an example of complexity of the array. There are 4 types of complexity. And this first one, complexity of the array, it's about the amount of things that are in front of the child at one time, the amount of stuff in a set group of things that we're looking at. And importantly, are those things touching each other? Are they overlapping? Imagine looking at this picture through a kaleidoscope, right? Imagine looking at this basket of stuffed animals through a kaleidoscope. They would all be overlapping and complex. They'd all blend together, and it would be very hard to pick out any individual one. But if we want to reduce the complexity of the array, take the single object out of the busy background and put it against a simple background that's not visually cluttered, that has no complexity. And this is a great reminder and example that CVI is not about size. It's not about making things bigger. Making it bigger wouldn't reduce the complexity. It's about removing it from the complex background that makes it hard to visually process and pick out one item from another. So even further away, this is much easier to find. Even smaller, this is easier to find for a child with CVI. And it's also not about contrast. It's a misunderstanding to say that CVI is about increased contrast. It's that complexity, reducing complexity, naturally increases the contrast. So we don't want backgrounds that blend in. We want things that pop out and stand out. Okay, so the complexity test that I often do in functional vision assessments with kids with CVI is this. And I just came up with this one. You could totally make up your own. You can adapt this one too. So we've got this little plastic goldfish, right? A little bright orange goldfish. It's about 1 inch. It's a small material. Let's see, can the child find it against a totally plain background? Okay, completely plain background on the white rug or on a black board. If the child's not interested in this, you have a child who doesn't really care about this little toy, you might do the same thing with something that they do care about, such as an actual, edible goldfish snack, right? That might be a more functional way to do this for a certain child. If the child can find it against a blank background, can they now find it against a slightly busier background? But notice that all of these items are different colors. There's only one that really pops out as being the bright orange one that we're looking for. And also notice that there's space between them. They're not overlapping. So if the child can find this, now can they find it against a patterned background? And this is just, like scrap, cloth from the fabric store, a patterned background. But notice that on the pattern background, the orange really still pops out, right? Because it's a blue background and blue is on the other side of the color spectrum to orange. So it pops out pretty well still. Now, if they can do that, can they do that against a camouflage background with similar colors and very complex patterns where the bright orange object actually seems to blend in against the camouflage background? And what I've seen, this is basically a complexity sequence for the array. You go from least complex to most complex. You could probably add 10 steps in the middle here if you wanted to. You could try with all different kinds of backgrounds. You could try, if you're doing snacks, you could try with a placemat and get different patterned placemats. Get simple ones, get complex ones. What you find is that the child is going to fall off at some point along here, and we need to understand what's the falling off point, because that's going to help us figure out what can this child handle in terms of complexity of the array of materials in a school setting, right? In a functional setting for mealtime, for circle time, for literacy, and so on. How much complexity can the child handle? Okay, that's complexity of the array. The second kind of complexity is complexity of the target or object. Here you have 4 pictures of different objects, and you can see that they have varying levels of complexity. So same thing, we want to kind of know what level of complexity can your child or student handle. Do they need really like single colored objects without a lot of patterns on the surface? Can they handle a couple patterns? Can they handle a really complex one like the top one? Which would be really hard for a lot of kids with CVI. There's too much going on there. It will be very difficult to orient towards any part of it, to say, find the front, find the back, find the wheels, find the head, because it would all kind of blend together. Okay. The next kind of complexity is complexity of faces. And if we had a ton of time, we could make a little game out of this and we could see how many celebrities you can identify in this blurred picture of celebrities. What you'll find is you can probably identify quite a few of them. Of course, depending on, generationally, where do you stand and who do you recognize? But what this is all about is that complexity of faces overlaps with another characteristic, which we'll talk about in a second, which is visual novelty. Kids with CVI have a more difficult time identifying or even looking at things that are unfamiliar to them versus things that are familiar to them. Things that are novel or unfamiliar are too hard to process. These celebrity faces, even if they're blurred, are pretty easy if you've seen them enough. They're pretty easy to identify because you have in your mind a whole frame of reference for categorizing these images. Also, some of them have really strong characteristics that are easily identifiable, like number 8, Jay Leno, very identifiable from a certain shape of his face and his hair, etc. Number 12 is Nixon, very easy to identify from just specific characteristics that really pop out. Kids with CVI tend to be able to identify faces make eye contact with faces, or even regard faces that are familiar to them easier than people who are unfamiliar to them. So just because a child's not making eye contact with you or looking at your face, don't take that as a sign that they're not attending to you. Rather, it just may be that your face is very complex and unfamiliar, and it's hard for the child to process, so it's easier to look away. Okay. The fourth kind of complexity is complexity of the sensory environment, also called multisensory complexity. And kids with CVI are impacted by internal and external factors across all different sensory channels: auditory, tactile, physical, kinesthetic. There's a complexity of the environment itself that actually has an impact on the child's visual processing. Now, complexity of the environment impacts all of our ability to attend and to focus, but it shouldn't impact our vision, right? We should be able to use our vision even when we're tired or even when it's noisy. For children with CVI, when they're tired, when it's noisy, when there's background information, when there's too much complexity going on, when they're struggling to maintain trunk position or neck position, for a child who has motor challenges, that's actually going to have an impact on their vision. So this is highly unique to CVI. You can think of those again as external or internal factors. External factors can be things like lighting, noise, even the temperature in the room, right? When it's very warm in the room, we all get a little drowsy, but it doesn't mean that your vision is reduced. For a child with CVI, feeling a little bit uncomfortable can actually impact their vision and can make their visual processing lower than it would be in better circumstances. There's internal impact too that we may or may not have control over, but we need to be aware of. The child's tired, hungry, in pain. There's impact of medication. If you have a child who's on seizure meds that make them sleepy, well, it's actually going to impact their vision, right? Which is not typical of any other condition. And also just emotional, how the child's feeling is going to impact their visual processing, right? Very unique to CVI. One of the most common misstatements that I hear about CVI is that you have a child whose vision is highly variable or fluctuates from day to day. Their vision's always going up and down. It's inconsistent, and you hear that kind of thing. It's not the child's vision that's fluctuating. It's the complexity of the environment that's fluctuating constantly. The child's vision is remaining the same or getting better. It's the response to the environment that's fluctuating. So it may appear that a child has a very low level of visual processing when the environment is super complex, but that's not that they don't have the processing skills. It's that they're responding to a complex environment. Okay, so just an important one to really emphasize when you hear that statement, because I think if you put it on the child, you're not recognizing that it's your role as the provider or the family member to moderate the complexity of the environment, right? It's not on the child. It's on all of us as adults who control those environmental factors to modify. Okay. Next characteristic is need for light. We used to call this characteristic light gazing or non-purposeful gaze. We're now calling it need for or attraction to light, and there's an important reason for that. Kids who are lower on the CVI range in phase 1, maybe early phase 2, may do light gazing. Light gazing is staring at or strong attraction to bright primary sources of light. Why is that? Because in your dorsal stream, you get a lot of information about light. So kids who are really only using their dorsal stream, they're going to see light very well, and they're going to say, wow, that's interesting. I'll look at that. And they may do that when the rest of the environment is too complex. So they may do that sort of staring at lights. That used to be called non-purposeful gaze, right? It's sort of this staring off at nothing. It's looking at lights or just looking at nothing in particular. We see kids doing that most when they're overstimulated or when they're trying to attend tactily or auditorily. So it would be incorrect to say the child's not paying attention to me because they're looking away. In fact, it may be the opposite. It may be that the child is looking away so that they can attend to you, so they can listen to you or attend to something that they're touching. And they may need to look away in order to control for the complexity of the environment. So non-purposeful gaze is actually purposeful. It serves a purpose of supporting attention as opposed to avoiding attention. The reason that we're not calling it just light gazing anymore is that, well, actually, first I'll show you this. So just examples of light gazing, right? Child staring up at the light. Why are they staring at the light? Because they're trying hard to focus on this complex physical task of eating, right? And it's too much to deal with both at the same time. Same thing with this little guy. He's sort of looking off at nothing. Well, why is he doing that non-purposeful gaze? Because he's trying hard to attend to that complex sensory experience of drinking through a straw, especially if he has low muscle tone, and if this is like a sensory overwhelming experience for him. Consider as well that if you have kids who are in Riften chairs or adapted wheelchairs, of low muscle tone, low neck control, significant motoric challenges, they usually tilt those chairs backwards so that the child's head doesn't flop down if they don't have the neck control. Well, if they're tilted backwards, what are they looking at all day, right? They're looking at these horrible, bright fluorescent panel lights that we have in all of our schools. So that, of course, is just going to promote light gazing. It's also going to be highly distracting to a child if you're trying to show something to them, but behind what you're showing them is this bright light. So what you should do, if that's the case, is to the best degree possible, position the student away from those bright lights. If you can't totally control for that, then have a board like this, like a black, just, foldable board, readily available so that when you're showing the child something, you can show it like that, right? You can block off that bright light and show them something interesting to them or that you're trying to get them to attend to without that bright light getting in the way. All right. So it's not just about light gazing, like all the other characteristics. As we see progress along the range, we're seeing those previously more sort of stimulatory visual behaviors turn into functional behaviors geared towards understanding what the child's looking at. So now we don't light gaze anymore later on in the CVI range, phase 2, later in phase 2, phase 3, but we benefit from light to enhance our attending. Okay, so use of a light box to be able to focus on something that is a detailed bit of information. Using light to illuminate an object can also be helpful. These little kind of pocket flashlights is like $1.99 at a dollar store. Are very useful to be able to, if the child's not seeing something in front of them, shine a light on it and try moving the light and adding some movement if that's helpful. Okay, another video of that same student, because you got a good little vision of what her visual behaviors look like in a complex setting. Now look at how much better her visual skills are for attending and using direct eye to object contact when she's in front of a backlit iPad. Okay, watch this.
Small, circle, big, circle.
Okay. She's making direct eye to object contact. She's able to use a guided visual reach and keep focusing and looking at something while interacting with it.
Big, circle, small, circle.
Okay, and she's able to actually perform that task, right? Why is she able to look at this complex information? Because it's backlit, right? Because the backlighting or the surface of the iPad has that kind of glow to it.
Yellow, triangle.
And you can see she's doing pretty well with that. I've actually seen a student who was reading large print on an iPad, reading sight words on an iPad. And I thought, wow, this is amazing. He's doing great. Literacy wise, like he doesn't need much adaptations. This looks awesome. That same student was not able to read large print on a piece of paper because the paper didn't have backlighting. The iPad allowed him to anchor and focus his visual attention because that characteristic of light was still very important to him, even higher up on the CVI range. Okay. A few more characteristics, and I'm going to kind of like cover phases very briefly and then sort of wrap it up. Difficulty with distance viewing. Okay. Children with CVI can often only look at things that are close to them. They may be able to see targets that are a little further away if those things are moving, have a bright color, or are brightly lit. So you start to see these characteristics really overlap, right? They're not in isolation. They all kind of impact each other. Distance is not just related to complexity. Distance is actually the exact same thing as complexity of the array. Let's look at why. Here is a picture of, it's a little bit blurry, but it's a picture of a shape sorting toy, right? Bright yellow plastic shape sorting toy on a preschool shelf. Now, if the child is 2 inches away from that with their face right up next to it, it's very easy to see, right? It's a bright yellow thing and there's nothing else that I'm looking at. I'm just looking at this bright yellow thing right in front of me. But if you back up 6 feet, this bright yellow toy has a very complex array around it, right? The further away that we get from something, the more is in our view and the more complex the information is. If you're very close, you're not looking at all those things. If you're further away, you're looking at a busy array. So distance viewing is actually the same thing as complexity of the array. The closer you are, the less complex the array is. The further away you are, the more complex the array is. So we just want to be thoughtful about that. And next session, when we really dig into intervention, we'll talk about specific strategies and approaches for adapting for complexity of the array while not totally destroying your lovely classroom with all of your stuff in it. Okay. See, for example, further away, bright color can be used to get attention. Somebody wearing a bright yellow vest is going to be easier to see at a distance. Okay. The next characteristic here is visual reflexes. There are 2 primary visual blink reflexes that we should have. We should have a blink to touch between the eyebrows. It's a light touch between the eyebrows, sort of above the bridge of the nose. And that's actually a blink reflex that is established prenatally. Embryos, babies before birth, infants before birth, have a blink to touch between the eyebrows, even before they're born, even before they're using their vision. So that's a neurological blink reflex. Children with CVI often have that reflex completely absent. They don't have it at all. Or it's latent, meaning there's a touch and then it takes a few seconds before the blink, or it's inconsistent. Sometimes there's a blink and sometimes there isn't. So that's a red flag for a neurological visual processing disorder. Blink to threat, if something's coming at your face and you can practice just, with your hand, there should be a blink. That's not developed at birth, but that's something that should be established by, I think it's like, at least 6 months after birth. And again, children with CVI, it may be absent, it may be latent or inconsistent. Now, this is obviously the only CVI characteristic that we are not adapting for. This is just like a gauge to see where the child is in assessment. So, just a clear disclaimer that I'm not recommending that you poke kids in the face and do the blink reflex all the time. It's just to get a gauge of where the student is. Okay, in assessment, but it's an important gauge. We talked about this nest characteristic in the context of faces and in the context of complexity, but children with CVI look at things that are familiar better than things that are unfamiliar, including objects and environments. In typical visual processing, it's actually the exact opposite. In typical visual processing, when we see something that's unfamiliar to us, it makes us want to look more at it, not less at it. And we look closer with greater detail, and we use stronger and more discrete visual scanning skills when we see something that's unfamiliar, because our brain's trying to figure it out and make sense of it. With CVI, showing a child something that's brand new that they haven't seen before, we often see them look away as if that's too much to deal with, get that away from me. So a child earlier on in the CVI range may only look at things that are familiar to them. As they make progress, they'll look at things that are novel or unfamiliar, but that share characteristics of familiar things. And also novel things can be more difficult in the most complex environments, right? So you see again how these characteristics overlap. Here's a little meme that I found on the internet, it's got a picture of, I don't know what is going on in that picture, and it says, name one thing in this photo. I challenge you to name anything in that photo. I don't know if anybody can type in the chat box if you see anything that's identifiable. But as you're looking at this weird picture, think about what your eyes are doing. Okay. you are looking closer, right? You're not looking away. You're not like, whoa, that's too much to process. I can't deal with that. Don't show me that. Instead, you're looking closer. You're examining all of the little tiny details of a thing, which you wouldn't do if I showed you something familiar. You just take a look and think, oh, that's what that is. For this one, you're really scanning, you're visually exploring, and you're trying to categorize in your brain, what is this? What is he showing me? And you maybe, if you think that you know what something is there, like sometimes people think that thing on the left is like a jewelry tray or something. The reason you think that is that your brain is like a Google image bank that has millions of images in it. And when you search a term, when you look at something new, you place it next to hundreds of other images of things that look like that thing. And you try to categorize it and classify it, right? And you have a lot of images in that image bank. A child with CVI may only have one image in that image bank to compare against, or may have no images to compare against. So when you show a child an image of, a picture, I showed a child with CVI pictures of animals, and showing a child with CVI a picture of a bear, and the child said, dog, that's a dog. Now, why did the child think it was a dog? Because it was brown and furry, it had 4 legs, and it had a snout that was sort of a certain shape and the eyes in a certain shape. But the child wasn't able to categorize or classify, where does this fit with the other images in my brain? Because there simply weren't enough images. So this is why things that are novel are more difficult. There's no frame of reference, and there are no discrete visual observation skills and planning around observation and looking deeper into the details of things, because that's a ventral stream skill. So familiarity is easier for kids with CVI because CVI is all about learning. The child has learned to look at what's familiar to them and struggles to look at things that are unfamiliar to them. The last characteristic, and then I'm going to wrap it up for you guys, is visually guided reach. Difficulty with or absence of visually guided reach. Children with CVI tend to have trouble using their eyes and their hands together. What we usually see is a look. So I've got this toy truck in front of me again. A look and then a look away and reach, which we saw in that first video. Or we'll see look, reach, and then as soon as I'm touching it, I look away. Or we see look away, reach, and then as soon as I'm tactily interacting with something, now I can look at it, but only once I'm tactily interacting with it. So there's something going on there in that process of looking simultaneous to tactily exploring or physically reaching for something. The question that I often get about this is, what about kids with motoric challenges who can't reach? Can we evaluate this skill in those kids? Yes, absolutely you can. And my thinking around this is that visually guided reach is actually a similar, if not the same characteristic as multisensory complexity. It's all about, can the child look and do or experience with another sense at the same time? Can they look and listen at the same time? Can they look and touch at the same time? Can they look and have someone else touching them at the same time, like with hand under hand support? Can the child explore something while looking? And that's the same thing, I think, as visually guided reach for those kids who don't have the motoric skills to actually reach. So you see this kind of classic look away and reach. I can't look at that thing that I'm touching because it's just too much to deal with processing tactile and visual at the same time. As we've seen, the characteristics overlap. It's not just about color, it's about color and light. It's not just about movement, it's about movement and color. And also beware of complexity, because you might think that you're adapting with bright colors, but if you have too many of them next to each other, you're just increasing the complexity. And we see this a lot with communication systems for kids. So another tool or resource that I have for you is this observation notes. So all the characteristics that we've been through, I've got a list of the characteristics with little pointers underneath each one to let you know what you might be looking for depending on where your child falls on this range of visual functioning. So what I would recommend doing with this is just sit down and write down as many things as you've observed about your child or student in each of these categories, and talk to other people who work with the child. Above all, talk to the family, who probably has already figured out a lot of this stuff, but may or may not have the specific language or terminology to talk about it. And the very last thing before I completely wrap it up, I think we're totally out of time, is phases, right? We talked about this throughout. We talked about phase 1, phase 2, phase 3. Those fit into this continuum from 0 to 10. Phase 1 is around 0 to 3. Phase 2 is around 3 to 7. And phase 3 is around 7 to 10. Now, eye to object contact doesn't usually start, and this is my little chance to use my annotate feature in Zoom, doesn't usually start until around 4 to 5 on the CVI range, okay? So this is a good indicator for you. If your child is not making eye to object contact yet, then they are to this side of 4 to 5. If your child is making eye to object contact, looking directly at things, it's around here or anywhere forward from there. So that's sort of your gauge for where is my child if you're not sure, if you really aren't sure. In order to determine specific phase and specific numbers, you need to do thorough assessment, which we can discuss in detail next time too. Okay, so sorry to go a little bit over time. I want to just stop the share. Gonna turn it over to you guys. I'm happy to stay on and chat a little bit longer if anybody wants to. But otherwise, I hope that that was helpful. I'm sure it was an overwhelming amount of information, but if you have any questions, feel free to email me. I'm just going to put my email in the chat box. And I'm going to send all of the materials to Angel and Michelle in New Jersey so that so they have it too. Part 2, Angel, did you have a date for part 2?
I do. Part 2 is going to be December 1st at the same time, 3 o'clock.
Cool. Awesome. So anybody have any questions? Feel free to stay on if you do. I'll send you all of the materials too.
Okay. Well, if there are no questions, I want to thank Chris for being here with us today. I really appreciate it.